All right, let's jump right into this explainer. We're going to build a rapid 3-minute survival roadmap for your community health nursing syllabus. Basically, your ultimate cheat sheet.
38. That's the magic number of distinct essay topics drawn straight from your syllabus. We're talking 12 long ones and 26 short ones. I know, it sounds like an absolute mountain to climb, right? But don't panic. We are going to make this completely manageable by breaking the whole shebang down into 3 core, super easy to digest pillars.
Pillar 1, care for vulnerable populations.
Now, focusing in on that frontline care, a huge chunk of your exam is going to focus on population control. Specifically, you need to know the difference between temporary and permanent methods, and it's absolutely crucial you know the big frameworks supporting all this. I'm talking about the National Family Welfare Program, Mission Parivar Vikas, and of course the MTP, or Medical Termination of Pregnancy Act.
Right alongside that is the nurse's pivotal role in mental health. You've got to know how to identify and address things like depression, schizophrenia, and substance abuse under the Mental Health Care Act. Oh, and you're also expected to completely master geriatric care through the NPHCE, which is India's dedicated national program for elderly healthcare.
Moving right along to Pillar 2, systems, leadership, and data.
So the really crucial point here is understanding leadership. It's kind of like being the conductor of an orchestra. You need to know exactly how to supervise all these diverse frontline roles, from ASHA community mobilizers to auxiliary nurse midwives and multi-purpose health workers. It's all about ensuring they function together as one cohesive unit.
Plus, you'll need to trace how data actually flows up the chain, from sub-centers up to primary and community health centers. Be totally prepared to explain vital statistics, sampling, and how electronic medical records feed right into the broader health management information system. That's how we actually track community outcomes, so it's super important.
And finally, Pillar 3, crises and global agencies.
Look, whether you're handling a massive, full-scale disaster or just everyday clinic operations, strict biomedical waste management is literally vital. Examiners really want to see that you clearly understand segregation. Like, you need to know exactly what goes into the red bins versus the yellow bins, right? And for sure, the safe disposal methods to protect the public from outbreaks.
Now, to easily memorize that dense alphabet soup of remaining acronyms, just group them. It's way easier. On one side, put your national entities, like the Voluntary Health Association of India and the Red Cross. On the other side, list out the vital global agencies, like the WHO, UNICEF, and the UN Population Fund. These are the big players that dictate the broader health policies.
I know, it's a ton of information. But remember, behind all 38 of those exam topics are real human lives. So as a future community health leader, looking at these 3 pillars, which area are you actually most prepared to impact first? Keep this roadmap handy to guide your studying, and hey, you've absolutely got this.